Hi everyone, my name is Maha and I go by he pronouns. For today's workshop, I have taken the topic cystic fibrosis and hopefully you guys end up learning something from it. So let's start screen sharing. This is cystic fibrosis. Move on. Okay, so now according to Mayo Clinic, cystic fibrosis is an inherited disorder that causes severe damage to the lungs, digestive system, and other organs in the body. It affects the cells that produce mucus, sweat, and digestive juices. These secreted fluids are normally thin and slippery, but in people with cystic fibrosis, a defective gene causes the secretions to become sticky and thick. So instead of acting as lubricants, the secretions plug up tubes, ducts, and passageways, especially in the lungs and pancreas. Now, basically, cystic fibrosis, what it does is cystic fibrosis is an inherited disorder. Basically, mutations caused in the cystic fibrosis gene, which we'll talk about in another slide, in the next slide. Mutations in that gene um, causes defects in the production of this protein which the gene produces. Now, this protein is supposed to make your mucus, sweat, and digestive juices thin and slippery, but it actually reduces the water content of your um, it reduces the water content of the fluids of your body. So instead of making passageways smooth, they sort of block it because the concentration of ions or concentration of let's say nutrients is more than them being diluted by water. I'll get into that. Now, what causes cystic fibrosis? It's an inherited disorder, like we said. It's an autosomal recessive disease, which I'll get into later. It is caused by mutations in a gene called cystic fibrosis transmembrane conductance regulator, or the CFTR gene. The CFTR gene provides instructions for the CFTR protein. Like I said, it's located in body that makes mucus, includes lungs, liver, pancreas, and intestines, as well as sweat glands. Some of the proteins have also been found in the cells of heart and immune system. These mutations in the CFTR gene cause the CFTR protein to not work properly. So this causes the mucus to become thick and sticky and create blockages in the lungs and digestive system. Now, usually mucus coats hair-like structures called cilia, like in your nose, to trap dust particles and um, clear passageway of your nostrils, to allow air to pass through and filter it. And it sort of is a way for your body to get rid of them because mucus traps those dust particles. So, but people who have cystic fibrosis, that process does not work properly. Now, normally CFTR protein controls movement of ions from inside the cell to outside it. In people who have cystic fibrosis, mutated gene causes the protein to not work properly, which means that it somehow reduces the water content and the concentration of ions, especially sodium, increases. When this happens, sweat glands make sweat that is saltier. Then it is in people who do not have cystic fibrosis. There's less water in the mucus, which makes mucus thick and sticky, causes blockages in the lungs and digestive system. Now, this also happens in our not only in your airways but also in our skin, which produces really sticky sweat. It can cause infection, it can cause sinus infection. It also happens in intestines. Now, because it's happening in intestines, your nutrients, like the fluid itself, is so thick and sticky, it's causing blockages and not allowing absorption of nutrients to occur. It also interrupts the digestive process that occurs. Of course, we learned that CFTR proteins are also present in the digestive system, intestines particularly, and reproductive organs. I cannot get into reproductive organs because there are complications here and there, but since I haven't discussed about it, I'm not going to get into it. Now, how is it inherited? This is very important. Basically, every person inherits two CFTR genes. You need at least two CFTR genes to 1 second. When I was mutated person is inherited from one parent. Yeah, you basically need two CFTR genes, both those genes having mutations in order to inherit cystic fibrosis. If one of your parents carry the CFTR gene, which is mutated, while the other one has a healthy CFTR protein, you will be a carrier instead of the person who is affected by cystic fibrosis, and the generation that comes after you, the generation which you give rise to, might inherit cystic fibrosis. Now, cystic fibrosis carriers, two cystic fibrosis carriers, suppose both your parents are carriers of the cystic fibrosis, like both carriers of the mutations in the CFTR gene caused, you are most likely to have cystic fibrosis, and there's a 25% chance. So there's a 50% chance you can end up being a carrier. There's 25% chance of you not having it at all, and there's a 25% chance of you having it entirely. Now, now talking about autosomal, the reason why we say this disease is autosomal, just give me a second. Yeah, the reason why we say um, it's autosomal is because it occurs in autosomal chromosomes. It does not affect sex-linked chromosomes, which means that it can affect you regardless of the sex you are assigned at birth. So basically, it's autosomal recessive genetic disease. It's recessive because, oh yeah, the reason why it's recessive is because it does not occur in every generation. It's just a generation, and that's how it occurs. That's why it's recessive. And the percentages of you having cystic fibrosis are very less. According to some researchers, people of Northern European descent are most likely to have cystic fibrosis as compared to people of African and Asian descendants, who it's very uncommon, but science always presents the possibility of anyone having any disease. So, moving on, we'll look at the signs and symptoms. It most commonly affects the lungs. A lot of people with cystic fibrosis have a wheezing cough, may have wheezing and a cough, which may produce mucus or blood. Again, blood can be produced because the mucus some in a way affects the causes a pressure imbalance in your body, which causes a release of blood. Okay, so signs and symptoms depends on the organs affected. Blockage of intestine in the baby soon after birth, which means your intestines are affected. Clubbing of fingers and toes due to less oxygen getting to heart. Again, blockage of pathways, of especially oxygen flowing, especially if the CFTR protein is present in your heart cells. Fever, which may include night sweats. Again, you're more prone to developing fever if CFTR proteins have something to do with the hypothalamus or just about any gland that causes fever. Especially because CFTR proteins are also in the cells of your immune system. Your immunity is adversely affected when you have cystic fibrosis. Gastrointestinal symptoms such as abdominal pain, diarrhea, or constipation. Jaundice again happens. Jaundice happens when your liver is affected. Cystic mutations in the CFTR protein existing in your livers may cause you to gain jaundice. Low body mass index, being underweight, again, absorption of nutrients in your intestines not occurring, so that's how it happens. Muscle and joint pain. Muscle and joint pain can again be due to blockage of pathways. I'm not sure about that. Late growth of puberty can affect your, again, having low BMI, affecting the absorption of nutrients. It's affecting your entire system. So yes, salty skin and saltier than normal sweat, and sinus infections. We talked about sinus infections. Okay, diagnosis. You have genetic testing. You can do it through a screening test or a sweat test. Sweat test is like, just checking for levels of sodium and chloride in your sweat, making it normal. If the levels of sodium chloride in your sweat is abnormal, the diagnosis could lead to the possibility of it being cystic fibrosis. Prenatal diagnosis test, basically what happens is inherited genetic disorders such as Down syndrome, Turner syndrome, Klinefelter syndrome. No, Down syndrome is not inherited. Down syndrome sort of happens mutations within. I'm not sure. I don't think you inherit Down syndrome. I think Down syndrome occurs due to complications within the womb, mutations occurring within the womb. Klinefelter and Turner syndrome, that is inherited. That happens not because you're inheriting it from your parents, but because it's a chromosomal disorder. So, Klinefelter and Turner syndrome is basically when your parents, when fertilization occurs and mutation occurs after fertilization is occurring. That's due to Turner and Klinefelter syndrome. My point basically is that all of these disorders, they can be diagnosed through prenatal testing where the doctor will check the amniotic fluid, tissue from placenta, or the liquid in the sac surrounding your unborn baby in order to diagnose your child and check in case the child has possibility of inheriting any disease as soon as it's born. Again, it's cells from these samples are always checked for gene mutations. Infants with positive prenatal testing for cystic fibrosis will be further tested to confirm it. Sweat test for high sweat chloride. If you have high levels of fluoride in your sweat or high levels of sodium, this is a standard test. It might indicate cystic fibrosis or it might rule it out. Really depends. Even low levels of chlorine can actually may or may not rule out the possibility of cystic fibrosis. So it's important to check the sodium and chloride levels of your sweat. What is the treatment? Now, we need to keep in mind that treatments are tailored to an individual's requirements because mutations occur, even mutations have their own variations between, like, among every individual. So you cannot expect a child with cystic fibrosis to have the same treatment as that of an adult. Or maybe gender might also play a role, sex might also play a role in this. The time and severity of CF symptoms can differ widely from person to person, although treatment plans can contain many of the same elements that are tailored to each individual's unique circumstances, like I said. So combination of the following therapies are used. You can always research about gene therapy and how cystic fibrosis is treated through gene therapy. That is an external topic you can research upon. But we'll talk about few of uh, few of the following therapies. Now, airway clearance help to loosen and get rid of thick mucus which can build up in the lungs. Inhaled medicines to open airways or to thin the mucus. These medicines are made into a mist or aerosol that is inhaled through a nebulizer and includes antibiotics to fight lung infections and therapies to keep airways clear. Pancreatic enzyme supplement. If this increases absorption of vital nutrients. Again, your digestive system, it cannot absorb nutrients. You need enzyme supplements, you need multivitamins to sort of nourish your body if you have cystic fibrosis. You need a fitness plan. Again, you need a very, very heavily balanced diet that caters to your nourishment. CFTR modulators to target underlying defect in these CFTR proteins because different mutations can cause different effects. Medications have been developed. Medications so far developed are only effective for people with specific mutations. Again, mutations can then have their own variations and can cause different symptoms in different people. So certain medications cater to some people, while other people, it's still being researched for them, I guess. And that was the end of my PPT presentation. I hope you enjoyed it and learned a few things here and there. And I hope to see you in our next workshop. Bye bye. Just give me a second. Bye.